Everybody, welcome back to another episode of My Grandma Also Know. Today we have a colorectal surgeon, Dr. Aaron Poh from Alpine Surgical Practice. Welcome, Dr. Poh, please.
Thank you, Bridget. Thanks for the kind introduction.
Before we begin, tell us a bit more about yourself. So as a colorectal surgeon, what do you do on a daily basis? The
majority of colorectal work involves a lot of more benign conditions. So we deal with a lot of fistulas, we deal with a lot of hemorrhoids. Colonoscopy is something that's very common. People nowadays are getting more concerned about their health.
Okay, thank you, Dr. Poh. Right.
Wait, you're forgetting something.
Oh, okay. I think it's a challenge. Hold on.
Oh, there's a challenge. I thought the challenges come from my colorectal, the more complex.
Every episode we have new challenge. So let me read out for you. The team say that we have an extra challenge for you. Keep your answers within 30 seconds or you will have to do a forfeit.
The answers must be 30 seconds short or I must come up with the answer within 30 seconds.
30 seconds short. Right.
Alright.
Okay.
Enough.
A few moments later.
No, I'm fine.
Don't laugh, your eyes are tearing up.
So, mentioning of colon, right? What is the role of the colon in one's health?
The main function of the colon serves to concentrate and so-called make the feces bulky. So it absorbs water and absorbs what we call salts and electrolytes. And that is actually the so-called most basic function of the colon. But bear in mind that colon also has healthy gut bacteria in it that in turn help to regulate our bowel movements.
Oh, okay. Is it 30 seconds? Congratulations, you passed!
So that's what 30 seconds feels like.
Right. Okay. Last serious question before we move on to what grandma wants to know.
Yes.
So, who is especially at risk for colon disease?
So, everybody is at risk unless there is a very strong definite influence. Otherwise, everybody is at equal risk because everybody essentially is unknown. For those with a strong family history of cancers, particularly if their parents or their siblings, then certainly they are at much higher risk of having colorectal cancer. Dietary factors like processed meat, alcohol, smoking, obesity, diabetes are all risk factors too.
Okay.
Wait, before we start, need solution.
Yes.
Here's the fun part. We have compiled whatever grandma wants to find out. But for personal interest, I want to find out how long is a colon?
The colon's about 1.5 meters long.
1.5. Oh, that's like my height. Like slightly shorter than me.
Yes,
right?
thereabouts. You will stretch it from end to end, yes.
Okay, then small intestine?
About 3.5 to 5 meters.
3.5 to 5 meters. That's essentially 4 of me. 4, 2, 3, 4. Right. Sorry.
No.
I think I'm 1.6.
If the 4 of you are about 1.25 meters long. Tall.
Okay.
Yes, that makes you about like that.
Congratulations. I made you like take your first forfeit.
Oh.
Come please, forfeit.
Hey, I thought there were multiple questions.
That's like part A and part B. Under one question. Yeah, please choose.
Okay.
Yeah, choose the toilet bowl.
Okay.
What is it?
Janelle, something green? Oh, okay. So it's grated wasabi. So what must I do? Is this very good for colon health?
That question I should ask you. Is that very good for colon health?
I don't know. I'm sure as hell makes your nasal passages clean up. Okay. Quite spicy.
But you're taking it very well.
You need water?
No, I'm fine.
Don't laugh, your eyes are tearing up.
Come, pass water. So we move on to the next question. So farting is like human nature. I want to ask you this question very serious. Why are farts smelly?
The truth is, and I get that asked a lot of times, so usually I tell the patients it really depends on what you eat, what kind of bacteria you have in your system, how long does your bowels take to clear out your feces, and all these combined together to give everybody's farts its own distinctive order. So I'm sure you know in a car, in a lift, with your friends, and you smell it, and then you know whose is this.
Look at guilty faces.
That's essentially what it is.
So talking about fart, right? We move on to poop. Can our poop tell us about our colon's health?
I suppose that there are a lot of people who are often concerned about the colour of their poop. Some say brown, some say black, some say greeny, some say it's a bit yellowish today compared to yesterday. I think overall the actual colour per se, as long as within the realm of normality is alright. The concerns will come if there's blood, and also the concern comes if you have absolutely black stools akin to hair colour or charcoal for that matter.
Okay.
So as you can see, I'm not explaining further because I don't want to exit it.
Dr. Po, so we saw your analogy using chocolates on your Instagram,
Yes.
and we have specially prepared for you. Go on.
Okay.
Welcome back, Toilet Bros! This is the first analogy, chocolate analogy.
Okay.
Toilet bowl, please hold.
Yes. Oh, I know this. So, this analogy was the small hard pellety stools. For some of us, that you notice that you pass the hard pellety stools in little bits. That sometimes means that you're not drinking enough water. Try some probiotics, because certainly what you want is a longer tubular structure rather than little bits dropping down.
Do you want to eat it?
Okay. Not bad.
So we welcome the next toilet bowl.
Right. So for the audience, that's what this one looks like. Well, highly realistic. So this looks like the mushy sort with, I don't know, a little bit of a ragged edges, I suppose. Well, I think for this kind, your stools are a little bit too soft. You need a bit more fibre in your diet, and that will essentially then consolidate into the one single piece. This one don't eat off.
I am anticipating the third matong toilet bowl. I don't know whether you can tilt.
Oh, this one is warm. It tells a lot. Okay, so let's open and see. Aha! Right, so for the camera, everyone. So this is dangerous. This is essentially non-form stools, it's purely watery. If this is unusual for you and if it's happening many times a day, for instance, then I think almost certainly you should seek medical consult as soon as possible.
So we welcome the fourth analogy.
Okay.
This seems like a magic toilet bowl because all kinds of poop happen inside. So let us check out the fourth one.
So let's have a look. Well, this one's not too warm. Hopefully no surprises here.
Matong drop.
Ah, okay. So this is the ideal one, which essentially is sausage shaped, and for some people who are a bit more observant, you see little cracks and fissures on the surface. Well, the producers told me to have a go at it, so I guess I'll do that. Okay, let's see how it tastes like.
We are done with the analogy. Thank you, Dr. Po, for sharing different kind of poops that we should look out for.
Yes, you're welcome. And for the camera, I must say that I'm glad that segment was over.
Lucky I don't have to eat. So let us move on to the next question. Okay, matong, bye-bye. So can I just understand, why does constipation become a real problem as we grow older?
Constipation is not an issue only for elderly people. It certainly is also a problem for young people. As we grow older, the body's physiology changes. Physiology essentially can pertain to the speed that your motion gets moved along the intestines. It means that the type of bacteria inside your colon changes. It also means that the diet you eat changes, the amount of fluids you take changes. And all this will conspire to change one's bowel habits as one gets older. That's a very long question.
I only asked one question, but thank you for elaborating, that is insightful. Let us get our profit. Welcome back, Toilet Bros. Okay, please pick your penalty.
I'll pick the furthest one.
Okay, here you go.
That one.
Okay, penalty.
So another penalty again.
Wow, lucky man.
That's that again.
Wow, you're eating good stuff
Yeah.
from the toilet bowl. Right, lucky. You won't be. In this case, for grandma and also for general public, right?
Yes.
What should we be eating more to help with colon health?
I think as a general rule, a balanced diet. Certainly more water, and if you're able to keep water in, then more fiber, because then they will get soft, fluffy stools. And some people try some probiotics, and that certainly helps.
Okay, grandma always believed in the old wife tale.
Yes.
So let's debunk it, okay? So is it true that when you're in shock, your poop will be green?
So repeat again.
Is it true that when you're in shock, your poop will be green?
What shock?
Like
放車晒，
放青晒，加驚條。
Oh, I don't know what to say, but the answer is no. No, it's not at all. Certainly not. In no way related. The color of stools essentially boils down to what you eat and what bacteria you have. So grandma.
Right. I need to tell grandma. Sorry grandma, you're wrong. This one is a bit serious. What could blood in her tools mean?
So blood in stools can be anything from piles to maybe a fissure test, and that again comes out of constipation. For someone of grandma's age, if she's passing blood in stools, then she should certainly be concerned about a colorectal growth and therefore go for maybe a screening colonoscopy if she wants to.
Moving on to the next question. Sometimes once in a while I think I get a bit tummy ache, especially I'm interviewing you now.
Yes.
So when should I be worried about a stomach ache?
Well, I think if the tummy aches comes and goes, lasts for a few minutes or maybe at most half an hour, 1 hour and goes away by itself, then that's not too worrying. It's only worrying that if it's a constant pain, it worsens, it's present the whole day. Yes, those are worrying.
I think I have that the entire day before interviewing you.
Well, that's nervousness. I think that's not related.
So you know, right? Most people will have 3 meals a day. So does it mean poop 3 times a day is normal? Or rather, how many times should one poop in a day?
Well, there's no right and wrong. And again, it's something that patients ask all the time. So my answer is whatever that has been with you since you were young is your acceptable bowel habit. I have had patients, especially female patients, who pass motion once a week. And the key is that if you don't have symptoms in between, then that actually is fine.
Poop every day?
Yes. But if you do it every day, that certainly is better.
I think grandma is a bit thin and myself also a bit thin. I just want to know whether, is there any link with gut bacteria with weight loss?
There's no definite link with bacteria and weight loss, though certainly keeping a healthy environment of bacteria, the correct kind inside your colon and your small intestine, certainly helps to keep yourself healthy for that matter.
Good news. I think grandma is a bit worried.
Yes.
So just in case if she were to go for a screening and then find anything bad happen to be colon cancer, what should we do about it? What can you offer?
I suppose the first thing to do is to keep calm and wait for your specialist appointment. And then let the specialist talk to you. A lot of times now we do keyhole surgery. And it often is the case that if it was fortunately discovered earlier, then the outcome is very good. And I'm very proud to say that colorectal cancer is one of the cancers that tend to have much better survival than others.
Oh, okay.
Yes. Sorry to upper GI surgeons and HPV surgeons for that matter.
Colon cancer is the top 3 leading cancer responsible for approximately 1 in 6 of all cancer diagnosed in men, 1 in 7 in women. It's actually the most preventable cancer. Hence, do your screening timely and remember to always pick at your poop to check on your intestinal health. If you like this video, please follow us and like and comment below.
Terima kasih telah menyaksikan video ini. Dan jangan lewatkan video menarik lainnya dari channel Tkon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tkon TV.